Welcome. Thank you all for joining me tonight. I'm Tracy Brown, Managing Editor at WBEZ. And this evening, we're going to take you behind the scenes of WBEZ's Racial Disparities Project. It is one of the most important pieces of journalism that we have done this year. So let me tell you a little bit about it. In early April, WBEZ reporters Maria Zamudio and Elliot Ramos broke a story that basically showed that 70% of COVID-19 deaths in Chicago were Black residents. And that story really helped us to elevate the national conversation about racial disparities of COVID-19. And it wasn't long after that it became clear that Chicago's Latino communities were also experiencing higher rates of infection and death rates than whites. And then later on during the course of the reporting, nursing homes also became a focus. So Maria and her colleagues on the WBEZ's Race, Class, and Communities desk what we really wanted to do was show how racial disparities had impacted people's risk of COVID, the healthcare that they received, and their outcomes, which unfortunately meant death. And so we set out to speak to as many families as we could, but we settled on, our goal was to reach families of 50 Chicagoans who had lost their lives to COVID. And the team decided that we were going to focus on 4 zip codes, but in terms of finding people that we wanted to talk to, we focused on people in 2 zip codes. And there was a zip codes that one that had the highest rate of COVID-19 deaths in Chicago, and one that had the highest rate of infections per capita. And so what we're going to do this evening, we're going to check in with the 3 reporters who worked on that project about what they learned as they connected with the 50 families. So we welcome your questions. Drop those in the comment section. We'll get to them throughout the conversation for tonight. And we'll dedicate some time at the end of the night with your questions as well. So first, I'm going to bring Natalie Moore into the conversation. So Natalie, before we even thought about doing the Racial Disparities Project, you spoke with Patricia Fryson's family. And Patricia was the first person in Chicago. She was the first person in Illinois to die from COVID-19. And while her family wasn't part of this project, what did you learn from your conversations with families like hers?
I learned that she had pre-existing conditions. I learned that she was a religious woman who didn't fear death. She came from a really large, tight-knit family. And about 9 days later, her sister died of COVID too. So for the family, I talked to her nephew for the story, and he told me he loved to sing, and I found a video of the sisters, some siblings singing that I was able to put in some audio. I thought it was another aunt of his who died, and it turned out to be his mother. Mm-hmm. And he was in Texas. He couldn't come. And that also gives a glimpse into the double feel. You can't be there. You can't see them. You can't mourn them. And you have all about what happened.
So your reporting focused a lot on South Shore neighborhood, which fell into one of the zip codes, the 60629 zip code. Let's hear a bit from your story now.
In mid-April, Jillian Woodbury went to the emergency room for a urinary tract infection. The 32-year-old lived in the South Shore neighborhood at Rainbow Beach Care Center, a nursing home for people with mental disabilities. Staff took Jillian to the nearby South Shore Hospital to treat her infection. First, she tested positive for coronavirus. All seemed well.
We talked late Thursday, all day Friday, all day Saturday, all day Sunday, and one time Monday.
But Jillian didn't call on Tuesday, says Patricia Woodbury. She's Jillian's aunt and guardian. Patricia called the hospital and was told her niece was on a cooling pad to bring her temperature down and a nurse would get back to her. No one did, so Patricia called before she went to bed and again was told a nurse would get back to her. One finally did in the wee hours of the morning.
The next thing, the phone rang at 3 o'clock and they said she had took a turn for the worse. And I lived down the street from the hospital, so I was down there in 15 minutes.
When Patricia arrived at South Shore Hospital, Jillian had died. She was not in the intensive care unit and had not been placed on a ventilator.
My assumption is that she must have passed away in her sleep because she was just had a smile on her face and, laying in the bed.
So you'll find the link to Natalie's full feature in the comments section. And if you want to bookmark those so you can hear the whole story. So Natalie, when I was listening to that, I could hear the frustration about the communication that the family was receiving from the nursing home and the hospital. Was that a recurring theme that you heard from other families as well? And can you talk a little bit about that?
It's a recurring theme in the 60649 zip code, and we'll hear later in the 60623 zip code as well. Team restrictions, you can't come to the hospital, you can't advocate. And I think that that's extra important safety net hospitals when you're dealing with not the best resourced nursing homes. Mm-hmm. And when you can't be you're only calling or waiting for someone to call you back, then that leads to some more frustration. Loved one taken care of properly? Was your loved one just part of an overwhelmed system? And, it's that maybe their loved ones would have lived, we don't know that, but mm-hmm. There is no comfort in not. But I also learned that there were people who did not trust the safety net hospital. Safety net meaning, that they mostly take people who, for example, these are not Research One hospitals. They're not attached to an academic center. And from South Shore to Oak Lawn to go to Christ. Another woman, even though her mother died, she took her to Northwestern. And, COVID is such a savage disease, but it does help a family to know their loved one got good treatment.
Okay. We've talked about how you, in the course of this project, you probably spoke to more families than anyone. What was it like trying to navigate those calls?
It got tougher after George Floyd, for sure, because then it's just Black death that's on your mind. It was hard to find cold calling them through databases or mm-hmm. finding them through Facebook. And they're like, how did you find me? How do you know this person died? She didn't die of COVID. I was like, you didn't see the medical examiner report and you're not a relative, and so there's maybe some denial often, but, I imagine there might be some denial for some people, but overall, if you find someone, there were very few people who said no. And what I did hear frequently is that they didn't want their loved one to be a statistic. And it was a little cathartic for them to talk about their loved one. As a reporter, this isn't COVID, but I always writing obituaries mm-hmm. at newspapers because these are many profiles of people and you get a glimpse of who they are. I write about them in a way that's not formulaic, the way that you might see in a paid obituary or an obituary that someone, these are portraits of people. And folks wanted to keep talking. And people were also honest. There's a little bit of a paint by numbers for reporters when they go out and interview family members of someone, notwithstanding. No one ever wants to tell like the family drama. It's always, she would give you the shirt off her back. She I'm not saying those things aren't possible, but everybody says those things about their loved ones because they also are holding them to probably deal with their grief. But once we keep talking to families longer, yeah, he was a drinker. Yeah, she did this, or he was a, or tidbits that make them human. And I don't think these are insults about the people, but you don't to have died from COVID. And I think that's something with Black Death too, that we think that you aren't supposed to die if society deems you deserving. And that doesn't matter.
Exactly. Yeah. Thank you, Natalie. So we're going to, Natalie, thank you for being with us tonight.
Thank you.
Stick around. We're going to bring you back in just a few minutes. So, all right. So now we're going to turn to Maria Zamudio. During the course of the reporting that Maria did, she focused on community hospitals like St. Anthony's that serve the North Lawndale and the Little Village areas. So we're going to take a listen at Maria's reporting from St. Anthony's.
While St. Anthony struggled to care for COVID-19 patients, some residents suffering from the coronavirus never made it there. Interviews with family members reveal that the distrust of community hospitals was so strong that some immigrants either delayed seeking care or avoided going to the hospitals altogether. Hospital officials acknowledged the distrust, but they said it comes from the current political climate. Fernando Vera had a series of health problems that kept him in and out of the hospital for years, and it left him with many negative experiences. His daughter Julie remembers one in particular.
Because I remember when he had his foot infection, the first thing that they wanted to do is chop off his leg. But my dad, he was not the type of person that he's just going to agree with the first doctor. He went to another doctor, and that's when he had his treatment.
So when Julie's father got COVID-19, he did not want to go to the hospital. Julie didn't agree, but she didn't want to force him. She delivered food and medicine, but when she got the virus too, she couldn't check on him.
So I didn't get to see him for 3 days because I was really ill. And I called my sister, he could go check on him, and saw his window, and he was on the floor, unfortunately. And my dad, unfortunately, he passed away alone.
What I will do is just talk a little bit about Maria's part of the project, which was really focused on the zip code of 60623. And Maria was actually one of the great things about this project was that we had tried over a course of time to really kind of reach out to a lot of hospitals and to get information on PPEs and ventilators. Most of the hospitals were uncooperative with us in that regard. And to Maria's credit, she was able to get St. Anthony's to really share some information with us and their data with us that a lot of the other hospitals didn't do. And then in addition to that, not only did they share the data with her, they also gave her some access, which gave us a really good opportunity to, get inside the hospitals and talk to some of the healthcare officials, which was great. And this part of the project also dealt with some of the distrust in the hospitals and distrust for healthcare. And we'll talk in general with a lot of the other team members as well. So what we're going to do, particularly because I think it's really important for you all to hear from Maria specifically. So what we're going to do is we're going to move forward with Esther, and then hopefully we can figure out the technical difficulties that we're having with Maria, and then come back to that. So. All right, so welcome, Esther. So Esther focused on nursing homes, particularly on Villa at Windsor Park. And we're going to take a listen at some of the story, Esther's story.
Villa's struggles point to broader issues in the nursing home industry, especially among for-profit facilities that serve mostly low-income people of color.
Everybody was scared. We were scared for ourselves, and we were scared for our residents as well.
That's Francine Rico. She's a certified nursing assistant at Villa. She's worked there for 23 years. Rico says Villa at Windsor Park has been understaffed for years. Federal data shows the facility is in the bottom 20% of nursing homes when it comes to staffing levels for nurses and CNAs.
These are situations that we had been crying about before COVID-19 hit here.
When some workers got sick with COVID-19 and had to stay home, Rico and others took on a lot of extra patients on their shifts. She also says in the early weeks of the pandemic, the staff didn't have the personal protective equipment that they needed. Rico says masks were scarce and that Villa doled out a curious piece of PPE.
It's a raincoat. It's yellow, it got the hood, it got the little string, but that was what we started with.
So Esther, when I was listening to the full clip of that piece, one of the things that really stood out to me was that one of your sources called what was happening at nursing homes, and I quote, not just negligent, but criminal. What did he mean by that?
Well, those were the words of Eric Russell. He is an activist who actually moved his mother out of Villa after she became infected with a virus there. And you know, Villa at Windsor Park has one of the highest COVID-19 death counts among the state's nursing homes. And when COVID-19 hit, it didn't surprise anybody, especially researchers who had been studying the industry here in Illinois, that Villa would have the highest number, you know, one of the highest number of deaths. But what Eric is referring to was the firing of a nursing home administrator who at the time, you know, early on in the pandemic, he had a meeting with his senior staff and he said to them, he confessed to them that he had allowed the virus to run rampant through the nursing home and that he himself had been infected with the virus. And so Eric Russell is somebody, you know, who is well trusted in the community. And so people came to him and asked him for help with this issue. Villa Healthcare, the parent company that owns Villa at Windsor Park, fired the nursing home administrator. So that's what Eric is referring to. But, you know, all along, even before COVID, Villa was challenged with understaffing, lack of resources. And so when the deaths happened here, it didn't surprise anybody.
Right. Now, did Villa or anyone from the nursing home industry have a response to the issues that you were raising in your reporting?
Well, Villa declined to do the interview. They sent a statement saying that they would not comment on personnel issues, and so they didn't want to discuss the situation with Levi Israel, the nursing home administrator who was fired. But they also said that they followed all CDC guidelines, and you know that nursing homes everywhere have been challenged by the virus. I put these questions to the for-profit, to the nursing home industry at large, and representatives said that, you know, nursing homes everywhere have been challenged. They did not want to decline. They declined to comment on the business model of nursing homes, which some people call it a model of extraction. They take revenue and they don't spend it on patients, but use it to enrich the company, right? So there's also some blame going around on the state's health department for not doing enough to inspect these nursing homes and making sure that these places were doing what they were supposed to do.
Right. You know, and I mentioned early on that during the course of the reporting, how nursing homes have become a focus of the reporting, and where we were seeing where more than half of COVID deaths were actually associated with nursing homes. And so one of the most heartbreaking stories of the entire series, at least for me, was Brittany Anderson, whose mother, Barbara, had gone into a nursing care facility just 6 months before the pandemic. And I'd love for you, can you share more about their story and what Brittany told you and shared with you about her mom?
Sure. Brittany's stories was one of the most painful ones to report. Her mother, Barbara, had been admitted to Villa in November. And Brittany told me that, Barbara's health was improving and that they were getting ready to bring her home so that Barbara could live with Brittany. And so when the virus came to Villa, her mother would call her and say she was scared. She wanted to come home. She saw nurses and CNAs coming in and out of the room without changing their PPE. She was just really concerned and she was scared, and she told Brittany that she wanted to come home. Brittany, for her part, did everything she could. She called and wrote emails to the nursing home to find out what they were doing to protect residents. But in the end, Barbara was sent to the nearest hospital, which is South Shore. And like many other folks, she died there. One of the most heartbreaking parts of my interview with Brittany came when I asked her what she missed most about her mother. And she said that her mom used to call her many times a day for no good reason. And it was always when Brittany was at work, and Barbara would ask for her daughter to buy her snacks, like, can you buy me some cookies and cake? And Brittany, before all this happened, she said she used to be so irritated by these calls, and now she would give anything to get a call from her mother.
All right, thank you. And Esther, we have a question from Tamara Collins, who asked, where is Villa located?
Villa is in South Shore. It's on, I'm so sorry. It's been a little while since I reported, but it is on Exchange. Hold on 1 minute. I'm just Google mapping this. East 75th Street. So the location is 2649 East 75th Street in South Shore.
Right. And another thing with Villa was that, and forgive me if you mentioned this already, it had one of the highest death rates of all of the nursing homes in Chicago, right?
Correct.
At least at the time when we were doing the reporting, right?
Yes.
So, and you had done previous reporting, not just about Villa, but about nursing homes. And can you talk just a minute about what that was like? I know did a lot of it ended up factoring into this report.
Absolutely. I mean, early on in the pandemic, nursing homes were one of the first places to be just hit. And they say that the population, the demographics in nursing homes is obviously most prone to, dying from this disease. And so early on, we reported on the lack of transparency in reporting deaths. We reported on the dire working conditions of staff. And we found that from data from the Illinois Department of Public Health, that more than half the COVID-19 deaths in the state were actually linked to nursing homes.
Right. Thank you. Thank you, Esther. So we're going to come back to you, join us later. And now we're going to try to go back to Maria. I think we've figured out the technical difficulties with Maria. Welcome back, Maria. So
Hi.
I will start. Hello there. So I'm going to let you finish. I had asked you a question about how you broke the story back in early April. So we'll just start from there.
Yes, thank you for being patient with all these technical difficulties. Basically, as part of a reporter that works on the race, class, and communities team, we are really aware of how race and segregation can really impact the lives of Chicagoans. And we wanted to understand what was going on. And early data started coming in about how comorbidities were deadly. And so we wanted to make sure that we were looking at the deaths by race. And that's really how we started looking into the disparities around COVID-19.
Right.
I'm gonna hold a little bit to see if you're able to hear me.
Yes, we can hear you.
Are you able to hear Okay, wonderful. And so, when we got the data set from the medical examiner's office, we were able to really look at who was dying. And at that point, it was early on in the pandemic. We were about a month in, and the numbers were startling. I mean, 70% of the COVID-19 deaths were concentrated were among Black Chicagoans. And that population accounts for 29% of the population in Chicago. So we knew that the numbers were pretty disproportionate. And that's really when we started looking into other issues that were playing out during the pandemic.
Right. So you had reported that North Lawndale and Little Village neighborhoods had the highest rate of COVID-19 deaths. What is it about those communities that put them at greater risk?
Yeah, so the 60623 zip code is an interesting zip code. Half of the population is an immigrant population, Little Village mostly immigrant population, and then North Lawndale is a mostly Black community. So when we were looking at the number of cases, we noticed that the Little Village, or the 60623 zip code, had the highest rates of infection and the second highest rate of deaths. And so we knew that this was going to be a neighborhood that we wanted to look into, that we wanted to take a closer look at what was happening. And after doing interviews in this community, something became really clear. The number of people that couldn't work from home, so they were exposed to the virus just because of the work that they did. They were essential workers. They were undocumented immigrants who could not afford to stay home, so they ended up going to work. And the other aspect of that is that a lot of families live in crowded spaces. So of the people that we talked to, they were about 70% of the respondents said that they had contracted the virus either because someone in their home had gone to work or had gotten infected at work and then brought it back. And so that really shows you that this community was really susceptible to the virus just because of where they worked. The other issue that came up was something that Natalie talked about, and that is that the community members did not trust the two nearest hospitals, community hospitals, and that was St. Anthony Hospital and Mount Sinai Hospital. And that created a lot of problems. I actually interviewed two families whose parents or whose family members actually died in their apartment because they were trying to avoid going to the hospital. I mean, that is the level of distrust. There was a number of conversations that were happening among immigrant communities about whether or not you would get access to healthcare if you had or didn't have a Social Security. So those were some of the biggest issues that were happening. Not to mention that the rates of diabetes, the rates of high blood pressure were pretty high in this community. And we now know that those comorbidities can turn COVID-19 deadly. Right.
Thank you, Maria. So now we're going to bring back the rest of the team. And remember, we would love for your questions from our audience to ask us anything that you want to. So if you could just put those in the channel, we'll get started on the Q&A. So welcome back, Esther and Natalie. So first, I'd like to, we'd also want not only for you all to ask questions, but we'd love to hear from you all as well. But before, I'd like to share some of what we have heard so far. So we have a comment from Michelle who says that race is not the risk factor, racism is. Do any of you have any comments from that? From Lucy's comment?
Yeah, she's right. I mean, we know that race is a construct. We know that that COVID doesn't care what your race is, but we do know that communities that are segregated these are the ones that are at risk, even regardless of income. One thing that didn't get to go into our story from Dr. Monica Peak, who studies race and healthcare at the University of Chicago, she talked about the Latino factor, how when immigrants come to the United States, they're healthy and they don't have any of these issues or comorbidities, but then they develop them over time after living in a place, say like Little Village. And I remember early on, Dr. Linda Ray Murray, another doctor who we quoted early on, she talked about the water as a metaphor. Okay, well, what is your environment? So you do all the right things, but you are in this polluted water, and that's the neighborhood, whether that's actual pollution or, housing plays a role, violence, all these to the environment that you live in. So, those, I love the way I love the way Dr. Murray articulated. Also, I didn't understand that about Latino immigrants and what their health is like, but they move to the United States versus what it's like once they have been here for a while.
Right. So we have a comment. Thank you, Natalie. We have a comment from Anna King who says that thank you for giving voices to these courageous frontline workers who sacrifice their health under grossly unfair pressure. So the one thing that I did want to, for all of you, I would love to hear, you talk about a little bit, even though you reached out to 50 families, you actually, spent, countless hours reaching out to hundreds of people. And I know that took an emotional toll on each and every one of you. Talk us through what that was like and how you managed to kind of like process and navigate those very hard calls.
As I was thinking about this event, I was kind of remembering back to those few months where the three of us were making these calls, and it just kind of brought me back to those really feelings of dread that sometimes I felt in the mornings, because I knew that I had a day of calling dozens and dozens of family members asking, are you the family of so-and-so who passed from COVID? And that absolutely took an emotional toll on the three of us. And what we did is over Slack, we just kind of supported each other. We shared successes. We shared tips on how to, make the most of Spokio, which is one of the tools that we use to reach people. We also, supported each other after particularly difficult interviews. And this was all while we were doing daily work, right? So we were covering the Floyd protests. Maria's covering immigration. I'm covering census. Natalie's covering housing. All of these issues that have actually been exacerbated by COVID, and we're trying to, fit in these interviews with families of loved ones. So absolutely, it took a toll, at least on me.
I think that one of the things that comes to mind is that, at least in the community that I was reaching out to, there was a lot of mistrust. I think that immigrants are just they don't really trust a lot of people, and so they met me with concern and doubt, and it was on me to make sure that they understood who I was and what I was doing and the purpose of that. So I spent a lot of time really explaining a lot of things, making sure that they understood what I was doing. And we had instances in which some of the family members were not happy with me, and I had to really step out of myself to make sure that I was reacting to the family of someone who passed away of COVID-19, who was very upset at me, to understand that it wasn't really about me. It was her way of grieving, right? Like, it was easier to feel that anger towards me versus feeling the sadness of losing a loved one. And so I think that reporting from the lens of like just trauma-informed reporting and making sure that you're doing things in a way that is not harmful to the community was really important to me. So I think that level, and I ended up having to do some door knocking and delivering letters and doing things that were very difficult, because you're having to confront people face to face, and you're having to provide a space where they can feel safe, and they can talk to you about what is going on. And that was really hard.
Yeah. Thank you, guys. So I have another question. I hope I'm saying her name right. Tamara asked, and this may be a question for you, Esther, what are hospitals and nursing homes doing to address their resource issues like employees, PPE, et cetera?
Well, I can only really speak to the nursing homes and what they're doing. I think early on, they just managed as best as they could. I mean, there were some times when CNAs were carrying double the load of what they typically carry in terms of the patient load. And so early on, I think it was just chaotic. And now, over time, there was a deal with the union, CIU, which sort of helped bring a lot of those workers back into the fold and, increase protections for those workers. And so there was a deal made there. I think, some folks are relying on sort of like temp agencies to fill these roles. And so I think it's been a rough go for nursing homes, but at the same time, if you look at their business model, that's not helping. They could do other things to mitigate the damage and to improve the safeguards for patients, but that's a choice that somebody has to make.
Right. Thank you, Esther. So Suzette asked, could you share whether anyone was held responsible in the death of the mother that Esther shared about earlier?
So on that case, I don't have an update yet. I know that Brittany was suing the nursing home, and I don't have an update on that case, but that is a case that's moving through the court.
Right. So, and then the next question is why it is important for WBEZ to take on a story like that. I'll start by saying I think that part of what we try to do at WBEZ is really to help people understand whatever is happening. And I think that it's one thing when Natalie did that first story about the first person who died and was able to get her family to share, and then weeks later the sister died. And then, it was 3 weeks or so, I think, by the time that Maria broke the story again about, the early data that we were seeing that was showing that 70% of COVID deaths were Black people in Chicago, at least in the city of Chicago. And I think that it was important for us to tell that story of not just like, reporting the numbers. We want to give understanding and meaning. And I think this particular project allowed us to not just, but to show what disparity looked like and to show it in a very human way. And I'm grateful to all the reporters for the work that they did on it, because I know it was grueling and emotional and just to make those calls each and every day to so many family members. But we were able to show people what disparity looks like. And, so I don't know if anyone else had anything to add to that.
I think you said it perfectly.
Yeah. So how was, how was it received, at least from either the family members that you all talked to? That was another part of the question, from in general. Did any of you talk about that?
Jillian's family, who we heard the clip from, felt like this was her obit, that she didn't get to have a funeral. That's the other thing too. People weren't able to gather to remember their loved one. So they did her justice. I didn't hear back from everybody. I did send out to people. And if people want to hear more, there are 2 audio montages of tape we got from family members that weren't able to get into our stories, where our producer, Joe Dussault, really mixed them beautifully. So you can hear not just what happened to them, but the kind of people that they are. And it just makes this real, because we hear these numbers, even, I mean, as horrific as 200,000 is number, I think, to wrap your heads around that these are real people. And a lot of Americans know someone who's been sick. They know someone who's died. But I do think it's important to hear, and just as often as we can, say their names.
Right. Thank you. So I just want to take a moment to thank all 3 of you for the extraordinary work that you did on this project, and also for taking the time tonight to kind of take us behind the scenes of what that work was like. 2 weeks from today, you'll be able to hear part 2 of this project. Alden Lowry, who is the senior editor for Race, Class, and Communities, will join the team for a discussion as he looks at how we address the racial disparities in our public policies and our healthcare systems. So you'll find the link for that event in the comments as well. So please register to receive a reminder for part 2 of the conversation. Again, we just thank you for joining us this evening, and hope that you all have a good night. Thanks for joining us.
Thank you.